You're walking down the hall to your chemistry class when you see him. You swear you seen the guy of your dreams when suddenly...
Just butterflies. Everybody has gas cramps, bloating, and diarrhea every day, right? No focus. I should talk to him. Yeah, maybe a popcorn and a movie? Maybe a corn dog, too. Maybe not. What's wrong with my stomach? Even thinking about it makes my stomach hurt. Oh no, he's coming this way. Act cool, don't think of your stomach, walk normally, smile, and...
That looked like it hurt a lot. I hate to tell you this, Gracie, but it looks like you've got more going on than just butterflies in your stomach.
All diseases begin in the gut. These are the words of Hippocrates, an ancient Greek physician often referred to as the father of medicine. He spoke those words in 300 BC. He was likely hinting to the first recorded case of Crohn's disease, which was described as being bad diarrhea after eating bread. Crohn's disease is one of two major types of inflammatory bowel disease, or IBD. It was named after some really smart guy that lived a long time ago, but I can't remember his name. Yeah man, any person at any age can develop Crohn's disease, but it commonly starts between the age of 15 and 35. Nobody really knows what causes Crohn's disease. Researchers believe that there might be a viral or bacterial component in the development of the disease, but it seems to be the result of an overactive immune system because anti-colon antibodies are often present in the blood. There are some genes linked with increased risk of developing Crohn's disease, but it is more common among the Jewish population.
So, what are the symptoms of Crohn's disease?
Let's see what happens if we give Gracie Crohn's disease. How are you feeling? Crohn's disease presents itself in different ways. Some people never notice, while others get really sick. People with Crohn's disease usually experience weight loss, diarrhea with blood, fever, crampy abdominal pain, loss of appetite, and a general feeling of not so good. Unlike an infection, the symptoms can last several months or even longer. You better see a doctor.
Hi Gracie, I'm Dr. Harper. How are you feeling? I'm glad you came to see me because your stomach really shouldn't be doing those kinds of things. Have you ever heard of something called Crohn's disease? Crohn's disease can cause inflammation and ulcers anywhere in the GI tract, from the mouth to the anus, but it's more common in the small intestine. And there's no blood test around to check for Crohn's disease. Diagnosing Crohn's is based on the patient's medical history and symptoms. Once Crohn's disease is suspected, a patient should have a colonoscopy to confirm the diagnosis. So Gracie, from what you've told me, I recommend you schedule one pretty soon. Yep, just as we suspected, there's ulcers in your colon and small intestine. If we look carefully, you'll notice that not all of the colon is affected. There are some parts that are healthy and other parts that are not. See, the ulcers resemble cobblestones. Now that you've had a colonoscopy done, it's time to talk about what can happen with Crohn's disease. Crohn's disease can cause inflammation or an infection that spreads outside of the intestines. Typically, this won't produce any symptoms right away, but it's best to have a CT scan as well. Now, where were we? Crohn's disease can cause fistulas, which can cause poop to ooze out to the surface of the skin and form ulcers, anal fissures, which can form deep grooves or tears in the anus, and lastly, the perianal disease, bowel obstruction or perforation can also happen.
I'm doomed! Everybody's going to know, and they're going to laugh at me. I'm going to have to run away to Canada. And I don't even like maple syrup.
Okay, it's time to give Gracie a break. There's no known cure for Crohn's disease, but treating the symptoms work pretty well.
Cut! The script says that she's supposed to be feeling better.
Drugs to control diarrhea, long-term sulfasalazine therapy, and medication to relieve the abdominal cramping are pretty good in controlling the disease. Eating small frequent meals, a low-fat and low-fiber diet that's high in proteins and calories is best. Avoiding foods that contain gluten also helps a lot, while avoiding foods containing lactose has been shown to help some people. Occasionally some surgery is required to remove an infected segment of the intestines. There's no good blood test for Crohn's disease, but a high white blood cell count and anemia are common. It is a good idea to have these tests done once in a while to rule out other problems.
Let's recap, brothers and sisters. Crohn's disease can affect any part of the gastrointestinal tract, but is most common in the small and large intestine. The causes of Crohn's disease are unknown, but we do know that it happens as the result of an overreaction of the immune system. There might be some viral or bacterial infection at work, and genetics, specifically having a Jewish ancestry, has to play a role. For each brothers and sisters, symptoms include weight loss, diarrhea with blood, crampy, abdominal pain, fever, loss of appetite, and a general feeling of not so good. Crohn's disease can be diagnosed with a colonoscopy or CT scan. Both will be able to pick up the patches of diseased tissue in the colon. Treatment of Crohn's disease focus on managing the symptoms. Medicine that stops diarrhea, abdominal cramping, and long-term sulfasalazine therapy are good for controlling the disease. Eat small meals. Eat a diet that's high in protein and calorie. Avoid food that contains gluten and lactose. Sometimes surgery is used to treat Crohn's disease.
People with Crohn's disease can still live a normal life. Crohn's disease likes to flare up occasionally, like when you're sick, stressed, or upset. And this may require extra visits to the doctor. So off you go. Thanks for all your help.